চলে এসো, এগিয়ে এসো, ক্যামেরাটা খুলে গাও।
একটু এগিয়ে এসো, একটু এগিয়ে এসো।
দেখো,
ঠিক আছে।
चल एक साथ, चल एक साथ सब मिलके पकड़िए ना, सब मिलके आपने पकड़िए हाँ, आप
सामने देखिए, सामने
एक बार सामने। हाँ ओके।
Thank you, sir. Thank you, ma'am. Thank you, Jamil. Thank you, Vedashri. Now, I would also like to take this opportunity to showcase a 100-second film based on a true story of a 24-year-old man with a rare brain tumor. He was treated with proton beam therapy, and his journey uphill and ultimately how he overcame the condition and became a winner. He believes in the saying, never give up and always have hope. And when the road ahead looks dark, trod on, but just around the corner, the light is waiting to shine at you again. Here, I would just like to briefly tell you about his journey to about the condition, which I'm sure Dr. Sapna Nagia will be elaborating more on that, but just to give you a brief about it. So Jamil, he's from Surat, and he got married. Then after that, like life was full of dreams and things. Full of dreams. They had both of them, Jamil and his wife Bansari. They are globetrotters, to say so. And then life was going on smoothly for them. But suddenly, their life came to a standstill. For a moment, it was as if, as if something bad had happened to them. And after several rounds of visiting the doctors and the hospitals, the doctors told him that he was diagnosed. The doctors later diagnosed him with a rare brain tumor called astrocytoma. So it begins in cells called astrocytes that support nerve cells. Some astrocytomas grow very slowly, and others can be aggressive cancers that grow quickly. As the doctors broke the news, definitely the family was they were disappointed. And after searching for nearly 3 to 4 months, they came across Apollo Proton Cancer Center, where they got treated. And so I would also now, in this context, I would just request the technicians to showcase the film here. The clinicians at APCC told that he has to go through an MRI, and then his MRI imaging showed an opulated expansion lesion in cervicomedullary junction with minimal perilesion edema. So which I'm sure, as I said earlier, Dr. Sapna, she will be elaborating more on this. And this imaging features suggested that low-grade astrocytoma, being from, as he was not a clinical person from a non-medical background. So he was clueless as to what the clinicians were telling him. However, the clinicians at APCC took the family through the entire journey and explained it in such a way that that they had faith. They started having faith in the treatment. So I will just.
In fact, it was our yearning for wanderlust that brought us together. The day I held her hand, I knew यही मेरी soulmate है. The first promise we made was हम हर सफर में एक दूसरे का साथ देंगे. पर जिंदगी अचानक रुक सी गई. And life seemed to have different plans for us. I was detected with a very rare brain tumor. एक पल के लिए लगा जैसे life will not be the same again. पर बंसरी ने हार नहीं मानी. She was determined we win over this together. That's when we discovered Apollo Proton Cancer Center. Proton beam therapy से कुछ ही दिनों में I started feeling the difference. Now, I'm leading life to the fullest with my soulmate. Thanks to this technology. आज मेरे पास उसके लिए एक surprise है. To renew our wanderlust and walk with her once again, hand in hand.
Thank you. And the protagonist of the film is amongst us this afternoon, Mr. Navdiya Jamin Mansoor Bhai. Please give him a round of applause. Thank you. Now I would like to request Dr. Sapna Nangia, Senior Consultant Radiation Oncology, APCC, to open the press meet and share the knowledge about the advancement and advantages of proton beam therapy for cancer care.
Good morning and welcome. It's indeed a delight to be here. Thank you. To firstly share this movie. We are not just because it's it's not a film, but it's actually dramatizing something that Jamin actually went through, and we're delighted that he could be here with us today, and he's going to share with us what his journey was like. And with that, we will be able to illustrate why proton therapy. And of course, Megashri will also tell us a little bit about her journey, again, of proton therapy at APCC. But before that, I'd like to tell you a little bit about the technology. You do know that this is the proton therapy unit, which has been set up in Chennai, is the first proton therapy unit of the country. It's also the first proton therapy unit in this part of the world. So for a long time, at present also, we have only one unit in South Asia and Middle East, and amongst the South Asian, if we include Southeast Asia, we are still the largest proton therapy installation. Not just that, there are many developed countries that do not have access to proton therapy. For example, countries like Australia, New Zealand, it still has to be established, and in fact it is a testament to the fact that it is a technology that is not available in many parts of the world, that we have had patients ranging from Australia to Chile, in fact, who have traveled to Chennai to seek this treatment, proton therapy. So that brings us to the question of why, or what is it that is the advantage of proton therapy that we are so proud of having brought to the country. In that respect, I'd like to tell you a little bit about the advances and the advantages of proton therapy in cancer care. Why do we need to know about proton therapy? As you know, there's been a very rapid increase in the number of proton therapy installations all over the world. In the last 10 years, they have more than trebled. So in 2010, there were 25 installations, and in 2020, there are 95 installations all over the world. And when we look at what is happening in the rest of the world, we find that there are some 42 installations in US, 35 in Europe, and 26 installations in Japan, of which 19 are of proton and 6 are of another kind of, 7 are of another kind of particle beam therapy. So we see that even in socialized medicine, where there's socialized medicine, like in Europe, where most of the healthcare is paid for by the state, even there, for every 121 million people, there is a proton therapy unit. At present in India, there is only one proton therapy establishment for more than 1.4 billion people. So how is proton therapy different from photon therapy? And I'd like you to look at the screen. What you see, the white bar represents the tumor, and blue represents how a normal X-ray behaves. What are these X-rays? X-rays means radiotherapy. So approximately 70% of all cancer patients are going to require radiotherapy as a part of their treatment. It may be used with curative intent, like for carcinoma cervix, for cancer of the voice box, for many other cancers. It is used as curative intent. And in many situations, we use it as a post-operative treatment. We use it to enhance the effect of surgery and to make sure that the cancer doesn't come back. So what you're seeing here is that tumor is there, the X-ray has crossed it, and it is continuing to deposit its energy beyond that also. However, when we look at proton, it stops at the tumor. It doesn't go beyond. It hasn't covered the entire tumor, so we put another energy and we put another energy, and now the proton beam is covering the entire tumor. But most importantly, it is not going behind the tumor. What does that allow us to do? It allows us to spare any normal organs that are lying behind the tumor, which means that we are able to reduce any radiation-induced damage to the normal structures that lie behind the tumor. And because of that, we are able to protect the normal tissues and protect them from getting damaged. Sometimes, if the tumor is very close to a normal structure, we may not give the tumor high enough dose because we don't want to damage a critical structure. Like, say, for example, the nerve from the eye. We don't want the patient to lose vision, so sometimes we may choose to underdose the tumor. But with proton therapy, that does not happen. With proton therapy, because we are sparing the normal organs behind the tumor or adjacent to the tumor, we have a higher chance that we will be able to give full dose to the tumor. Also, because the energy is being deposited with such intensity, the damage to the DNA of the tumor cells may be more. It may be more difficult to repair those damages to the tumor cell, and that's why in certain situations proton therapy actually has better outcomes. Better outcomes mean patients has a higher chance of surviving. So currently proton therapy has been around for about 50 years. But the older generation of machines were very cumbersome. So you're seeing many parts out there. All these parts had to be put in the machine before we could treat the patient. And it was cumbersome, and it was not as effective in sparing some of the tissues. But the modern radiation technique that we use now is called the pencil beam scanning technique. In this pencil beam scanning technique, you are seeing this 3 millimeter beam of proton. And the one in maroon, that irregular structure that you're seeing, is indicating the tumor. And as you can see, there is a pencil beam that is coming and it is painting the tumor layer by layer, but it is not going to any tissues around. And that is how proton therapy, now this is representing the dose. The orange is the high dose, and the orange high dose is confined only to the tumor and not going to any of the surrounding organs. And that is how it works. The most critical explanation for this, I would say the most effective explanation for this, is to look at this slide. You are seeing the picture of a child. You are seeing that the brain and the spine of this child is colored in red. The brain and the spine have to be treated because the patient has a tumor that can travel in the brain and the spine. But we don't need to treat anything else. The middle picture that you see is what happens when you treat with X-rays. The light green is representing all the unnecessary radiation that is going to the patient's lungs, the stomach, the liver, the kidney, all the organs that are lying in front of the spine. And the one that you are seeing extreme on your extreme right is the extra radiation that a child will not receive when they receive proton therapy. So the message that I want to give is, see, children are the most susceptible to the ill effects of radiation. They can have growth retardation, they can have hormonal deficiency, they can grow up to have impairment in their intellectual capability, their memory may be smaller, become less because of treatment, and they also develop second cancers because of the effect of radiation. Now, why are we so concerned about children? Because childhood cancers have very good outcomes. So we have to plan for these 8-year-old, 10-year-old, 15-year-old children. We have to plan for the next 60, 70 years. They are going to live a long life. They have long possibility of having side effects because of radiation that may manifest today, or 10 years later, or 15 years, or 20 years later. When we are restricting the dose to the normal organs, we are decreasing the possibility that these patients will have any side effects because of having this treatment, having had cancer treatment. So what you can see here, the graphs that you're seeing, the small bars represent the cancer risk after proton versus the tall bars represent the cancer risk 15 years after treatment, after X-ray treatment. So it's very, very clear. The risk of cancer comes down very, very significantly when patients, childhood cancer patients, receive proton therapy instead of photon therapy. Again, in children, we are very concerned. Their school performance is not only about getting marks in school. Their school performance is a representation of their intellectual ability, that as they grow older, whether they will become self-reliant, whether they will be employed, whether they will be able to get into meaningful relationships. So what happens is, with proton therapy, the intellectual outcomes are much better. So if we look at intellectual outcomes like global IQ, perceptual reasoning, working memory, these are things that are much better in children who have received proton therapy. Similarly, hormonal deficiency is much less. The pituitary is a gland that is lying inside in the brain, that controls the hormones of the entire body. It controls thyroid hormone, cortisol, growth hormone, the gonadotrophin hormones, which help the child to attain puberty. All these can get suppressed because of radiation, and when patients receive proton therapy, the chances of these hormones getting suppressed become less. Now, we are interested in this reduction in toxicity, but are we interested only in children? No, we are not interested only in children. The next group of patients we are interested in is adolescents and young adults. Now, adolescents and young adults also, if they have curable cancers, are going to survive for the next 50, 60 years. And we have to plan for that. So now what you are seeing is 3 separate pictures. On top, on your left, you're seeing a CT scan of somebody's jaw. And what you're seeing in red is the area that has to be treated. This young man, who is 27 years old, has a cheek cancer. And what you're seeing in red represents the dose that needs to be given. Now, all the other doses that you are seeing are unnecessary radiation. What you are seeing is, in proton, no unnecessary radiation is going to the other side. While in photon, you can see the green, the blue, and the turquoise colors are covering the cheek on the other side. Each of these represents dose that is being received by the opposite cheek of this child or this young man, predisposing him to having second cancers. That predisposition becomes less with photon therapy. Similarly, the middle frame you see is through somebody's chest. And what it is telling us, the dark blue stain that you are seeing is indicating the dose that is being received by the heart. So we know that patients who have received radiation to the chest, young people, when they have received radiation to the chest, they have a higher risk of having heart disease even 30 years later. And that is what Proton helps us to do, reduce the risk of having cardiac disease. And what you are seeing on your extreme right is this young lady who required treatment for a tumor in the small of the back, you know, the bone that is there in the last bone in the pelvis. And just in front of her were her ovaries. So if she had been given conventional radiation, there is every possibility that she would have lost ovarian function. She would have had menopause at a very young age, in her early 20s. But we were able to bring the dose to the ovaries down to less than 3 gray. We measure radiation in grays. So even though we were giving 70 gray, the red thing that you are seeing, the 70 gray to the tumor, but we were able to bring down the dose to the ovaries. And what you are seeing on the MR on top is showing that the ovaries are functioning and you can see the eggs. Now, this is for adolescents and young adults, but when you're looking at, you know, even older people, now this is a young lady who lost vision because of a tumor. Her tumor impacted her eye nerve on one side, so it had become very, very critical for us to save the eye nerve on the other side. So you can see here, I think the diagram is self-explanatory. What you see on the top panel, you can see the eye in blue, and you're seeing the nerve in yellow, and you can see that no radiation dose is reaching there, or what I mean, not, I shouldn't say no, but what is permitted, it is receiving less than that. And lower down in the scale, you are seeing the tumor, which is visible as white behind the eye and between the brain, and then on this side, on the extreme right, you are seeing that the tumor has disappeared. But what was most gratifying, effectivity of Proton is displayed in this. You're seeing the nerve being spared very nicely, but most importantly, what was very nice was that this is representing a visual field. So not only was the vision of the preserved eye preserved, but even the vision on the other side improved. So on top, you can see no round area. That is representing that she was not able to see. But in the lower frame, you are seeing her current vision status. Her current vision status is that she is largely able to see normally from even the affected eye because the tumor melted and released her optic nerve. So this is what, you know, sparing the optic nerve, reduction in toxicity, and interestingly, improved outcome. Both. So this is a representative case showing the power of Proton. One of the things that, you know, one of the emerging areas where Proton is being used and is going to be used more and more, I feel, in the coming years, is reduction of heart disease because of radiation. So, you know, left-sided breast cancer patients, in India we have a very high proportion of diabetes, hypertension, obesity. We are more likely to have cardiovascular disease than the rest of the world. We also have it 10 years earlier than the rest of the world. Now, when Indian women are developing breast cancer, naturally, we have to be concerned, world over actually I should say, it's not just for Indian women, world over we are concerned about reducing, we want to reduce the possibility of treatment-induced cardiac disease. So again, as you can see, this is a slice through somebody's chest. You are seeing both the breast, the right breast in green, the left breast which is bathed in the yellow dose that needs to be given. Everything that is not yellow is unnecessary. In normal radiation, this unnecessary radiation comes to the lung, the heart, and the opposite breast, increasing the risk of having second cancers and increasing the risk of having heart disease. With Proton, we are able to reduce that. We have now treated a significant number of patients. We have written a research article which is currently under review in one of the academic journals. What is the quantum of reduction of the dose to the heart? As much as 75% reduction in dose being received by the heart. So that is the dramatic impact of proton therapy as compared to the best X-ray based technique, which is called DRPH. You know, in India, we are the oral cancer capital of the world. Everywhere else, lung cancer, prostate cancer are the most common cancer amongst men. But in India, the most common cancer amongst men is oral cavity. So when we give radiation to the oral cavity, it is a very difficult procedure for the patient to go through. The inner lining of the cheek is shed, pain nerve endings are exposed, raw surfaces happen. But with proton therapy, as you can see in this elderly patient's mouth, we are not seeing any reactions, even though we are treating the base tongue tonsil area, which is just behind the mouth. And that is something that is quite remarkable, and we have done some original work on this, again submitted for publication. I'll show you this extra radiation that a patient does not receive is the one that is represented in the blue on both sides of the cheek when somebody is getting tongue radiation. And this is how the cheek and the mouth of a patient can be spared, even though the tongue is being treated. You're seeing that the top of the palate, the top of the mouth has no ulcers because with proton therapy we are able to reduce the dose being received out there. Sometimes patients need to be treated again, second time. If you have cancer that comes back, now the first time itself we are taking so much care that the tissue should not be damaged. So naturally you can imagine second time we have to be extremely careful. So again, this is one place where proton therapy has a big role in re-irradiation, giving radiation a second time, especially when we are doing it with curative intent. Elderly patients, because we are able to prevent side effects, naturally they benefit from treatment, and we have noted that our elderly patients are doing very well, and we have a special emphasis towards treating them. In middle-aged group, which is the working group, the ability to go back to work is much better after proton therapy. This has been proven in one randomized trial conducted at the MD Anderson Cancer Center in Texas, Houston, Texas. It's one of the major cancer centers of the world and one of the major proton therapy centers of the world. I just have one more patient to just demonstrate better disease control with proton. I'll show you this gentleman's, how this tumor was involving the entire face and going into the eye of the patient. You can see in the column on the side, the eye is being pushed out, and we were able to achieve a complete response in this patient. But most importantly, what you can see again, the extra dose that the patient did not receive. On the lower right corner, you're seeing all the extra dose that the patient did not receive because he was getting proton therapy. So managed to finish the treatment in time and also was cured of cancer. At APCC, we are very cognizant of the fact that we are the first people in India to bring this technology to the country. It's a privilege, but it's also a responsibility. So we have made sure that we have maintained records of patients, created what is called registries where we document whatever our outcomes are, and we have also published our data in various scientific journals. We practice what is called site-specialized medicine. So we have one team which looks after neuro-oncology, we have one team which looks after certain other diseases. For example, I look after head and neck, skull-based, breast and gynae. And similarly we have, so there is, the advantage of that is a focused approach, an in-depth sort of ability to understand the technology as well as to understand the cancer. Another important part of our team is medical physics. They are the people who do the calculations for the treatment, all the computerized treatment plans that you saw with the nice colors. And I have to say that they are also extremely active in the academia and publishing their work, which we believe will be of help not just to the scientific community in India, but the rest of the world. So in conclusion, this is the concept of survivorship. Survivorship is health and well-being of a person from the time of diagnosis till the end of life, which means we pay attention both to tumor control as well as to reducing the toxicity of treatment. And in multiple sites, proton therapy has these roles. In some, it improves control and survival. In some, it reduces toxicity. And in a number, it does both. Some of these are skull-based lesions Liver cancer, very important, where better control and survival outcome has been noted with proton. Inoperable head and neck cancers and sarcomas, chordomas and chondrosarcomas, eye tumors. And in many other tumors, there is significantly less toxicity with proton. We have now treated nearly 900 patients. A big chunk is neurotumors, after which we have treated a large number of head and neck cancers. As you see, a quarter of our patients are children, even though children constitute a very small percentage of cancer incidence in the country. But because they gain so much from proton therapy, their numbers are very large. I'd like to thank my team, our team at APCC, and acknowledge the proton therapy is not one person's job, not one man or one woman's job. There is a whole team that makes it happen. And on the top, I would like to acknowledge Dr. Jalali, who is our medical director, Dr. Srinivas Chilkuri, who is my colleague in the radiation department. Thank you very much for your attention. So we'll move forward from here, from my talk to listening about the experience of Jamin and Medashri at the Apollo Proton Cancer Center. And I think Jamin would like to tell us in his own words. तो बताइए Jamin.
Hi, good afternoon.
जी, सुनाई दे रहा है.
Hi, good afternoon. My name is Jamin. 2019 में मुझे यूरोप ट्रैवलिंग पे था. वहाँ से रिटर्न आया तो उसके बाद राइट हैंड और लेग में खालीपन जैसा महसूस हुआ. तो मैंने एमआरआई सूरत में एमआरआई करवाया. तो एमआरआई में मालूम पड़ा कि ब्रेन ट्यूमर है. उसके बाद हम लोग बहुत सारे डॉक्टर हॉस्पिटल में गए, डॉक्टर को मिले. तो उन लोगों ने ऑपरेशन के बारे में बोला, उसके बाद रेडिएशन के बारे में बोला, लेकिन किसी के पास 100% पे श्योरिटी नहीं थी कि ओके हो जाएगा. क्योंकि ब्रेन ट्यूमर ऐसी जगह पे था कि जहाँ पे हाथ पैर और बॉडी की शायद सब नस जो आती है उसके आसपास के निकल जा रही थी. और ऑपरेशन दौरान कोई भी नस डैमेज होता है तो बॉडी का कोई भी पार्ट डैमेज भी हो सकता है. तो डॉक्टर को 100% गारंटी नहीं था कि ऑपरेशन के बाद 100% सही होगा कि नहीं होगा, या तो फिर ऑपरेशन के बाद कोई भी बॉडी का पार्ट अगर डैमेज हुआ तो पूरी लाइफ को बेड रेस्ट भी होना पड़ेगा. तो हम लोग उसके बाद अपोलो प्रोटॉन के बारे में मालूम चला. तो हम लोग वहाँ पे गए. जब मेरे को कालीपन सुना वो प्रॉब्लम था, तो 3-4 महीने के अंदर प्रॉब्लम बढ़ता जा रहा था. खाने में प्रॉब्लम आने लगी थी, लिखने में प्रॉब्लम आने लगी थी, और चलने में बैलेंसिंग में भी प्रॉब्लम आने लगी थी. मतलब पूरा बॉडी का समझो 60 और 70% बैलेंस पूरा बिगड़ गया था, और लिख भी नहीं पाता था, और चलने में भी प्रॉब्लम आने लगी थी. अपोलो प्रोटॉन के बारे में मालूम चला. वहाँ पे हम लोग राकेश रतन जलाली सर से मिले. तो उसने पूरा डिटेल में हम लोगों को इन्फॉर्मेशन दिया कि इस टाइप का आगे ट्रीटमेंट होगा. तो हम लोग ने ट्रीटमेंट चालू किया. मेरा टोटल इधर 28 सेशन था प्रोटॉन का. उसमें से शायद 10 या 11 सेशन फिनिश हुआ तो 80% जैसा रिकवरी मुझे आने लगा था. राइट हैंड और लेग में जो भी बैलेंसिंग बिगड़ गया था वो समझो 80% जैसा रिकवरी होने लगा था. और ट्रीटमेंट पूरे होने के बाद शायद 4-5 महीने के बाद हम लोग वापस चेकअप के लिए बुलाए थे एमआरआई के लिए. एमआरआई हो गया. उसके बाद सब लोग डॉक्टर भी इतने हैप्पी थे कि रिजल्ट बहुत बढ़िया हुआ. रेडिएशन से कभी भी ब्रेन ट्यूमर का साइज जो होता है वो छोटा नहीं होता है, और प्रोटॉन से मेरा साइज भी छोटा हुआ था और पूरा ट्यूमर डीएक्टिवेट हो गया था. और फिर मैं 100% ओके हूँ, पहले से बहुत अच्छा है अभी. थैंक यू फॉर अपोलो प्रोटॉन team and doctor, thank you so much, and thank you my family supported me.
Thank Jemin had a cervicomedullary astrocytoma. So astrocytomas are not rare tumors. The cervicomedullary astrocytomas are rare tumors. They are at the junction of the brain with the spine, which is a very critical area. As he said, this is a location which is very critical. And there was a possibility that critical functions like the heart, like swallowing, like walking, like the breathing center, all of them would have been impacted. And it is really very gratifying to the team at the Proton Center to see the outcome of the disease, of the treatment has been so good, as you can see for yourself, as Jen has told us herself, himself.
ट्रीटमेंट के दौरान मैंने कभी भी मेडिसिन का ज़रूर पड़ा है और इसका कभी मुझे कोई साइड इफेक्ट भी नहीं हुआ 100% सेफ है और मैंने कभी मेडिसिन भी नहीं ली ट्रीटमेंट के दौरान।
आप अपने एक्सपीरियंस के बारे में तो कुछ बताना चाहेंगे अपन प्रोटॉन सेंटर में जाने?
अभी हमारे देश में कैंसर से बहुत लोग पीड़ित है और सब लोग बहुत डर रहे कि भाई इसका ट्रीटमेंट सही होगा कि नहीं होगा। तो मैं बताना चाहता हूँ कि अपोलो प्रोटॉन ट्रीटमेंट करवाए तो 100% ओके होगा और सही जगह पे ट्रीटमेंट कराएंगे तो ओके होगा 100%।
Thank you, Jamin. We now invite Vedashri. I'm going to let her, the young lady sitting on my right, she's going to tell us herself about what her story is. Okay? I'll let you do the introduction, please. As you wish, whichever way you want to speak in English.
Good afternoon, everyone. I am Vedashri Sania, 21 years old. I am a patient under Dr. Rakesh Jalali, radiation oncologist of Appolo Proton Cancer Center. I was diagnosed with brain tumor in June 2021. Then I underwent brain surgery in July 2021 in Kolkata. The biopsy showed that the tumor was grade 2 pleomorphic xanthosarcoma. So I was referred to Dr. Rimpa Achari, radiation oncologist of Tata Medical Center, Kolkata. She kept me under observation with MRIs, but however, in March 2022, a small growth was found in the brain MRI. So Dr. Rimpa suggested me to go to Dr. Jalali, her teacher. So we went to Apollo Proton Cancer Center, Chennai. Following Dr. Jalali's instructions, I was reoperated in April 2022 by Dr. Rupesh Kumar in APCC. There was near total excision of the tumor. Then the biopsy showed it was the same grade 2 pleomorphic xanthosarcoma. So Dr. Jalali now suggested that I should go for proton therapy, keeping my young age in mind, and because the tumor was of a recurrent type and it was located in a very sensitive region like the brain. So he also explained that proton therapy had minimum side effects compared to the conventional radiotherapy, and it spared the critical body structures like the hippocampus, pituitary gland, the axon, and etc. He also explained that it would cause very minimum damage to the surrounding healthy tissues. So my proton therapy started in July 2022 and ended in August. I required total 29 sittings. During the proton therapy, the radiation therapists were very helpful and cooperative. They made me feel very comfortable. I could also listen to my desired songs. They had arranged for music during the therapy sessions, which made me feel even more relaxed and comfortable and calm. So I felt no pain or any other discomfort during the proton therapy session. There was local hair loss in the head region where the radiation was given, but now my hair is again growing back gradually. And I went for follow-up in December 2022, and in the MRI, no residual lesion was found in the brain. And in my next follow-up, which will be in August this year, apart from the brain MRI, there will also be ophthalmology, endocrinology, and IQ tests. These tests were also done before the proton therapy because so I appreciate this holistic approach of Apollo Proton Cancer Center. Overall, it is a very well maintained hospital. I am very thankful to all the doctors, nurses, and radiation therapists, and all other staffs who have constantly helped me and supported me. But above all, I thank Dr. Jalali and Dr. Rupesh for the wonderful job they have done. Currently, I am totally fit and completing my final semester of BSc Zoology. So, proton therapy has given me hope for better survival and better quality of life. I want that more and more people come to know about this proton therapy in Apollo Proton Cancer Center, Chennai, and make the best use of it because it is the only hospital in the entire Southeast Asia that provides this life-saving proton therapy. Thank you.
I think Meenakshi has summed it up so nicely herself that I really don't have too much to add. But basically, it is precisely that because proton therapy restricts the radiation to the vicinity of the tumor and doesn't allow the radiation to go to normal structures, the side effects of radiation are going to be not there. The simple way of putting it is that they are not going to be there. And those are things like vasculopathy. Vasculopathy means inflammation and narrowing of the blood vessels, because of which there can be issues like stroke or hormonal deficiency or memory-related issues. All these problems and this is a tumor which has a very good prognosis, right? So we want to make sure that there is no negative impact of the treatment on Medashri. And that is what proton therapy allows us to achieve. So our twin goals of being able to control the tumor and the treatment not having any other negative